Hello and welcome everyone to Armanino's webinar. Today's topic is going to be on returning to work in a post-pandemic world. My name is Sarah Cheetah and I'm part of Armanino's marketing team. Before we get into the content, I have just a couple of housekeeping items. So you can minimize and maximize your webinar pane using the red, orange arrow buttons shown here. Also, to ensure good audio quality, please check your settings so that the appropriate audio option is selected. We don't have a dial-in number, so please make sure that the computer audio option is selected. And lastly, the deck and a link to the recording will be available 48 hours after the webinar. With that, I'm going to introduce our presenters for today. I'm going to start from the right. We have Octavio Laos, or OJ as we call him. He's a manager of our data and analytics team, and he's our tech guru on the panel. We also have Lisa Hagen, who's a senior manager of our HR outsourcing team and also an expert of her field. She has the ins and outs knowledge of all HR challenges organizations are facing today. And lastly, but certainly not least, we have Jen McCabe, who's leading the Return to Work program and leading the charge on this. And she's a partner of our consulting group. With that, I'm going to hand it over to Jen.
Hi, everybody. As Sarah said, over here, we are constantly barraged with questions about what employers and businesses should do next. And everybody's doing something differently. So what we did is we put together a cross-disciplinary team here to tackle the subject, not just in terms of tax or operations or finance, but also from an HR perspective, of course, because everybody's really concerned about that. And then we laid technology under and over and sandwiched all of our solutions. So that's why you're talking to the team here today. We have a sort of a broad approach to this issue. All right, let's go to the next slide. All right, so what we hear about every single day is how do I tell people what's going on? I had a call today from some people in Texas who said, okay, who do we tell if we think someone has COVID? And so communication is probably number one. We have a team here that specializes in communication strategies, especially crisis communication. So that's come up. We have a business intelligence tool that we will not demo for you today, but we'll show you the link. It is complimentary and available to the community at large and in the United States. It's a really cool thing for you guys to look at, and we'll talk to you about how businesses use it to make decisions. We have a Power App that will show you some screenshots that's really exciting. And obviously, we're not just talking about accounting, we're talking about policies, operations, tenancy. Are people going back to work? Are they negotiating their leases? If you do or don't go back to work, what's going on with insurance right now? Insurance is a crazy thing these days because nobody knows what it does and doesn't cover, especially in the new world. And of course, state and local tax matters impact every decision we make if we decide to push our workforce out and not return to an office. So let's go to the next slide. All right, the two pieces of technology that we're going to talk most now are our Return to Work app, which is a Power App, and that's why OJ is on this call. It will allow you an alternative to or a layer on top of taking people's temperatures. So this has been developed because a lot of the things that we're finding people have to do are just wildly impractical. And it's daunting to think about checking everybody's health and not violating their privacy. So we have an alternative solution here that's really cool. And then, of course, we're going to show you our COVID recovery tracker. Let's go to the next slide and talk about that a little bit. So the tracker is on our website. When you land on Armanino LLP, there's a link to the COVID recovery tracker. The first thing it has is case numbers by county and state. So if you land there and you go to your state and then you drill down to your county, it will show you the number of cases in your local area. And it tells you if it's trending up or down in 3 days, 7 days, 14 days. And businesses are using that data to decide how to pivot. So it's important to look at the trajectory. If you were in Texas 2 weeks ago and had been watching this tracker, you would have known that you were going to be in trouble. You would have known ahead of time and ahead of the news. So please use this tracker because it'll keep you ahead of CNN. The new thing that we added, which is fascinating, is a testing page. And I'll show you a screenshot of it because I threw it in the deck with Sarah at the last minute. The testing page is interesting because, as you know, testing varies from state to state, county to county. There are lines where people can't get tested. But what you want to know is the percent of positive tests of the tests that are being given. And we have that. And what's really interesting is you'll see the states that are in trouble with hospitalizations and a shortage of beds are the ones with the highest percentages of positive tests, regardless of the number of tests they're actually doing. Foot traffic is a fun thing to look at because you can drill down to your county and you can say, all right, what's going on in malls? This is using cell phone data. And you can drill into office spaces, office buildings, and see what's happening with foot traffic in those types of businesses in your county. And then you can lay that over the case tracker and see what's happening in terms of foot traffic as it relates to increases in cases or doesn't. That's also kind of interesting. You'll see foot traffic going up in ways that doesn't seem to affect the curve. Transportation is important if you're listening from Northern California and you have a population of workers that use BART, or if you're in New York or maybe Atlanta, where you have a population that are using the subway to get to work. If people aren't using the subway, what kind of policies are you developing to help people get back to their job? And then the last one is home versus away, which is really fascinating. And we do not have a screenshot of that. But what that is a page that says to you, how many people in your county are staying home 100% of the time, which is a crazy concept, but not so much anymore, right? Well, a couple, I would say March and April, when I looked at that, in many locations, more than 60% of folks would just stay home all the time. It went down about a month ago to more like 35 to 45% of people were still sheltering in place. It went down to low 30s, and now it's rising again. If you are in business and you want to know what people are doing, it's a good way to see whether people are out in the world again or not. All right, let's go to the next slide. All right, this is a screenshot of the testing piece for the tracker. It's a little cut off here, but you can see the United States, and you can see the states are red. Red is not good. If you click on the state and drill down to it, you can get data by county. But if you look at this, you can see Arizona is blazing red and it's at the top of this chart. I clicked on positives 7-day average in order to get it to sort this way. If you go on to the COVID tracker, please know this is a business intelligence tool, which scared me to death because I'm not a techie person. But what's really neat about business intelligence tools is that they pull data in from multiple places. And the data sources are listed on our site and below all this data. You'll see all the places we're pulling the data. And then it lands here and you can basically point and click wherever you want. So if you mouse over a state, it brings up the data for that state. If you click on the state, it drills down to the counties and you can select certain counties. Or you can click like I did on positive 7-day average and it will sort that column for you so that you can see where your state lines up or where your county lines up. Anything on this page, anything that is more than 5% is considered to be what our local governments anyway are using as time to hunker down again. So this page obviously shows several states where trends are not that great. What's interesting, though, is that Texas might be improving now. We'll have to see. That's maybe an improvement, 0.1%. It's maybe we should wait another day to see where that goes. But those green and red arrows are an indicator for a business person on whether you can feel a little more optimistic. So I, of course, love looking at this and looking at green arrows in my places where I'm helping clients. All right, let's go to the next slide. All right, Lisa Hagen, who is our HR aficionado, is going to take you through our app. And this is the app I told you about that you can use in place of temperature checking or to augment temperature checking. And it's a very practical and reasonable way for you to log the health of your staff.
Thanks, Jen. So the Return to Work app works kind of in conjunction with the tracker. So you'll use the tracker to make your business decisions and kind of think about what your tolerance is for risk. And then the way I like to think about it anyway, you'll use this app to act upon those decisions. So when you decide that you're ready for people to come back to the workplace, this goes in a few different phases. This first one you see here on the screen is for the office administrator to make sure that the workspace is ready for people to come back. And you can see that there's just a few quick drop-down questions to answer, and they'll go through that every day to make sure everybody's okay. You can see the next possible retake time would be the next day.
Hey, Lise, today we
Yeah.
were on the phone with a school, and the school wants to have the workspace or the school areas checked more than once a day. And OJ promised me that was easy to do. And they also were thinking about checking certain campus areas. So they might have it customized for a school several times a day, several parts of the campus, and they might add things that have to do with PPE laying around and stuff. So that's an interesting customization that's come up.
Yeah.
And the other one was real estate, buildings, building owners. They want the safety check to have a little bit more to do with different buildings. So you might want to have an office admin person in each of your 5 buildings checking in. So that's an easy customization too, to make sure that it matches your workflow.
Right. We're kind of getting asked in almost every case for some sort of customization. So we'll have OJ talk a little bit more about that. What's on the next slide, Sarah? So this is the part where the employees get to check in. They go in and do another little series of drop-down menus to tell us that they've taken their temperature and that their temperature is within the normal limits or required limits in this case to come in. And once they go through those questions, the app will give them some sort of a message like you see on the far right there with the results. Congratulations, you're fit for duty. And then you can go on to the next screen. And they'll get a code that, just depending on the workplace, will get them into their place for that day. Again, the next time to take the test is the following day.
Right, let's stop for a second. If anybody's looking at this screen, you can actually, if you have a QR reader, you can hold it up to that screen and you'll see that OJ took this test and that he's fit for duty. So if you were at the door of your office, you would not have to take his temperature. You might do that, but if you opt out of that yucky job, you could scan his QR code and you would see that he is actually fit for duty. And for schools, we talked to, this was interesting, they want to use the QR code for the senior school where the kids are allowed to have their phones on them. Or a college, this would not be a problem. They could go from classroom to classroom and check in at each one. That would be great. For littler kids, they would sign in on the school's site. Their parents would actually sign in and check them off. And if they don't have a cell phone, they might need to get a sticker or a QR printer to print out the sticker. And they would also be sent to a particular room, which is an interesting idea. The app can be customized to send kids, okay, you're supposed to check in at the gymnasium, or you go to room 101, which is a neat customization for educational institutions.
Definitely. And so then once you're confirmed to be okay to come back into the workplace, you will see this type of a screen that will then, depending on the workplace again, but be able to be used as kind of a hoteling or reservation system to book yourself into the particular desk or office where you'll be working. I can't remember if there's a map of that or not, but it controls it and kind of maps it out so people have the appropriate spacing and, you know, shows which places are not ever going to be open for people to be in. Maybe the conference rooms are closed for now for everybody, and you can see where you'll be sitting. It'll require a little bit of input to customize that and put in the map for the floor plan, but that's something that we can do.
So that's what we were thinking about using for the kids in a school, where we would upload the floor plan of the school and check them into a particular room where they actually go to check in.
Right. Right. And so then just to touch base a little bit more on what you were saying, Jen, there's so many different customizations that we've been asked for, whether it's timing like you talked about, or maybe even industries. You know, if you have construction workers and the office workers in one company, they're going to have some different requirements, different locations. Even today, we got a request for different languages. So with that being said, I want to touch on one thing that I'd be remiss as an HR person for not bringing up, is that the app is all tied into privacy and following HIPAA compliance standards. So it's not like standing in front of a line of people to get back into your office and getting your temperature taken and then sent home. So it's all handled privately and, like I said, compliant with HIPAA. So you'll want to use that information to make HR decisions on your policies and update as necessary. So the
Right.
reporting can also be set up.
Let me ask you a question,
Oh,
Lisa,
sure.
HR girl. So if someone checks in and they get a feedback that says, please don't come in, you just said you have a temperature over 100 degrees. What happens then? In your world, in an HR world, what would you like to happen in terms of CDC and HIPAA reporting?
In my world, I would want that information to go to that person's manager and maybe overall HR, and that's it. Unless there's a different workflow set up that would have other requirements, but you just want it to always be consistent and private.
Right, and then I could go back and ask you for that the next day to make sure that I knew who that person had been in contact with, because I would have the data to show who they'd been in contact with if they were in the office or school the day before.
Right, you could pull a report and see who all had come into the office that day.
Got it.
And with that, we'll turn it over to OJ so he can talk some more about the reporting and the customization and some of the tech details.
Yeah, thank you, Lisa. So what we're looking at here is a mock-up of a simple report. Now, the information that we saw on the COVID recovery tracker is on a similar BI platform. It's on Power BI. So you can really see the level of flexibility and customization from where we have, 50 data sources here to what might just be the one, and it could just be tracking the actual app usage itself. But what's nice about the flexibility and options that we have is this is where you have the ability to connect a lot more systems and a lot more information. This is where you get to the IoT side of things. And what does that mean? You're looking at temperature checks or other outside tools that you're using to determine safety and viability of the workplace. Part and parcel to what we're doing here is the ability to allow that customization to make the tool applicable to every single use case and the ability to expand upon that. And we do everything from just reporting on the employees checking in to a workplace check-in where we're looking to see, has it been sanitized? Has it been, treated up to whatever our new policies are? Especially important when it's a shared office workplace. Maybe you just have a floor in a building. Maybe you just have a single office. And we need to make sure that those questions and results are going to be specific to the use case and to the need. So Sarah, we can take a look at some more of the back-end information here on the next slide. Let's talk about what it takes to run. Ultimately, it's going to be, I think, the most successful is going to be any implementation that you have of any kind of new technology and software, and then this is return to work aside, it limits the amount of new steps that you're going to need. Adoption is going to be critical, especially in times like this. People are already facing new things for the very first time. They've been working at home for months. They might not even remember what it was like to go back to the office. Now you're giving them a bunch of new policies. They're worried about everything going on in the world. The last thing we want to do is add confusion or unnecessary friction to that return to the office. So what do? We have something that's simple and easy to use, working on a trusted platform, and is ready to go very quickly. So you're going to have the ability to use it from just from a website application, from Teams, which is a system that's being used more and more frequently now as you have more kind of hybrid remote work and people are returning to the office, as well as a mobile application. And that's, again, obviously super handy when you're pulling up QR codes and such and just trying to check in on the go. The only technical requirements are very easy. We don't require you to get any new hardware. You don't have to buy an iPad or a specific type of tablet or device to use this system. It's built using Microsoft, one of obviously the most common and trustworthy and protected software platforms that's out there. And all you need is an Office 365 subscription. E1, which is going to be, again, this is your standard Office user. You're using Outlook, you have PowerPoint, and in this case, what we're going to leverage is Power BI. And what that allows us to do is it creates a platform where we can get this installed incredibly quickly and in as little of a software footprint as possible. It's using a system that you probably already have. The added benefit outside of just the ability to get going is that all the information is actually saved locally to you as well. I know we mentioned HIPAA compliance, the importance of privacy and security. What we do is we actually save that information just directly within your Microsoft environment. So we just have a SharePoint site or just essentially a shared file that'll be limited to your HR staff or whomever needs access to it. And then that data lives there. We never receive it. Armanino never has any access to that information, and it's completely secure. So in that way, it's a very light setup and very quick and easy to go in a turnkey manner. Now, that doesn't mean, though, that it's limited or that you're only available to kind of be shoeboxed into a certain way. The examples we talked about already, we're looking at normal workspaces and offices that you'd expect, but schools, two completely different use cases. And what we do is you have the ability to customize these systems. Like I said before, you have the ability to integrate them into anything else where we can access that data. So again, whatever those other tools you're using, you can easily add that in, and we can easily share this information as well. If you have a different reporting tool or other place that we need to bring it, and that's where a tool like Power BI would come in handy, where we can do this customization and build on top of it. Because again, adoption is key, and ultimately that's the most critical part. So let's take a look.
OJ, I'm just going to talk in Jen speak for a moment because you're the tech guy. What you just said to me means that if I have Word, Excel, PowerPoint in my workplace, I'm very likely to already have the technology that I need, and my tech person can talk to you and your tech team, right?
That's absolutely right. Okay. And again, it's the most simple, the most basic subscription, I guess, to those services, truly.
Right. And I didn't really know much about Power Apps. And I want to say to everybody who's listening, if you're a Luddite like I am, it is that easy. You can download the app on your phone like any other app, and then you have it there and you just answer those questions, check in, and it gives you that QR code if that's applicable. And I've been coached by OJ when we speak to people about this, that if they have a Microsoft Office product that they're using, it's very likely that we can talk to your technology team and get you squared away in a matter of days, maybe a week, if there's some customization things that you need. So I want to make sure you understand it's not just easy for OJ, it's also easy for Jen McCabe.
And even if you don't have those licenses, they're relatively low bar to entry too. Again, compared to some of the other more expansive software and tools or something that might live on your server, there's something that's very affordable. Obviously, everyone knows Word, right? In the Microsoft Office suite, and they can run in almost any environment. So I think the key thing on this slide here that I want to talk about is this is no longer a nice to have idea or solution. And as much as I wish to say that we invented the concept of a check-in questionnaire, and while I do think our version of it is very important and successful, it's not something that is we're the lone voice out there in this way. There are a number of options that are to become increasingly available and quite frankly are going to become the standard. So the question then becomes not should I adopt technology to return to work safely, it's how should I do it and what should I use? And that's where I think as we get into the complete return to work philosophy, in package that Armanino has is where we clearly see that difference. Because what you often see in this space is a lot of security firms, a lot of software firms, putting together some great pieces of software in applications that can track the questions on if you should return to work. But where the importance lies is not just in the ones and zeros in the code that's being generated. It is truly in that entire package that we're coming at this, not as just your software partner, but as a trusted advisor on the consulting side, communications, HR consulting, and we'll go through the entire gambit here in a moment. But what that allows us to do is create an application and tool that's actually going to fit into your specific policy and needs and is going to have that in mind. Our goal is to make it as simple as possible and only make it more complex as necessary. And what we deliver is something that's widely applicable. Like we just said, it's running on very common software architecture, easy to use, easy to ramp up, and checks off all the boxes that we know you're going to need. There's a lot of questions as we return to work, and what we want to do is make at least this part of your life simple. Get everything, with that technology-backed solution in one convenient place.
Yeah, and on this slide, I will say that Salesforce, if you work with Salesforce, has a solution. It's pricier than ours, but I'm sure that it's slick. And then on the right, Perkins Coie is a law firm. And so they, instead of Lisa and her team, they will use the legal team to help with policy updates and things. So once again, I think, we're out there with the best of them, hanging in there. All right. So we're going to talk about your to-do list. If you're listening to us, there is quite a long list of things to think about. So what we tried to do is talk first about technology, because whatever you're doing out there, you should support your decisions with data. That is something that we believe firmly every business should be doing. Rather than reading up or watching the news and then coming up with a policy, that's part of it. The other part is use data. So the COVID tracker we talked about is free. There's no reason for anyone listening not to use it as one of their data points. The app, as OJ said, is a way to support your decisions with technology so that if you have or have not got a temperature taking mechanism in place, you have now got an app that is sucking all the data that you can give it into your SharePoint to some shared place where you have a record now of who came in to work or to school or wherever you are and said that they were going to show up. Now, the other thing I wanted to say about the app was we developed it largely because Lisa's team was thinking about all the HR policies and all of the risk that had to be mitigated. And we were really perplexed by the issue of taking people's temperatures. We were thinking through the person at the front door, should they be gloved up and have a face mask on? Or do they shoot from far away? Does that person write it down? And if they write down who tested yes or no, where does that piece of paper go that's safe and protects people's privacy? What do you do with someone who has a temperature in front of everybody else? What do you do if it's a super hot day in Arizona and everybody's waiting to get into work and they're standing 6 feet apart? OJ and the technology team at Armanino came up with a solution to help our HR team. So that's where the app was born. It was born of a practical requirement. So then we started also talking about tax, operations, because a lot of people said, forget it. I'm not going to take everyone's temperature. That is crazy making. And my team is dispersed now and they're out there on, all over the continent. They don't want to come back anyway. So we started getting those kinds of questions where you're not bringing people back. Well, that's a whole nother bag of tricks you got to think about. So we divided our listeners into two piles today. So there are people listening who are not going to go back to the workplace. There are people who are going to return. The lists are actually the same. You have to do your HR policies. While you're doing that, and you need to start now, you need to think about what's evergreen, because some things have changed forever in our worlds. What things are you going to sunset the second there is some sort of vaccine? I see today there might be one in January. Well, that means we just have to hang on for 6 more months. What are we going to do with that? Operations to me has to do with insurance and anything to do with your tenancy, where you are in your business. Communication and technology we've covered. If you are not returning to your traditional old workplace, we really have to talk about the tax effects of that. There is going to be a tax impact on the owners, the entity, and the employees if they do not come back to the workplace. It's a big change. If you are returning, that's where we talk about physical safety for your employees, employers, clients, communities. All right, so think of it that way. You are either going back right away or not, and you have a short-term decision-making tree and you have a long-term decision-making tree. So now what we're going to do is take you to our to-do list, and please don't faint, anybody. It's a long list. All right, let's go there. All right, Lisa and I have been doing casual little 10-minute talks about different sections of this list. So we've got the tech, app, and COVID tracker, which we just took you through. We think about this in 3 ways. We have readiness and planning, which everybody should be doing now. And then we go all the way over to steady state, which is, okay, we're sticking with this. This we're going to do for the next 5 years because this is actually better. And then there's this interim period, which is we're reopening our workplace. We're trying to ramp back up and get revenue going back where it was. And we have these policies that are maybe interim that we need to think about. So when we think about operations at Armanino, we obviously have been talking about health reporting, but we also are really looking at timesheet tracking or employee tracking. Some of the new CARES Act legislation specifically needs timesheets to back it up. You can get big tax credits if you've been tracking time, for example. Meanwhile, if you're going to disperse your staff to the winds, you need a really good privacy setup in your cybersecurity realm. So we have experts here at the firm that's all they think about. They do cybersecurity audits and recommendations for people. So that is going to be something to think about. It's no longer just that someone is running across your Zoom meeting nude. It's bigger than that. You need to be careful. We are also thinking a lot about travel. And that isn't just travel to other states and countries, it's the workplace. Who is going to be allowed to your workplace? And are you going to allow your staff to go to other places, other workspaces? If you're using the COVID tracker and you see, say that I'm in Southern California in El Segundo, and I have a client in Riverside, and Riverside County is in really bad shape, and one of our clients wants us to go out there and meet with them. Do I want to have a policy for my employee to say, no, you're not going to Riverside? This has to be one of your interim sort of strategies. Let's go to the next slide. All right, Lisa, if you're listening, please interrupt me if I miss something, because I know you've been looking at this with me.
I'm sure you'll be fine.
Okay. So one of the biggest issues that we have, there's been a lot of email coming from our SALT team, our state and local tax team on this. We have many clients calling who are giving up the ghost and saying they are not going back to their traditional office environment because they've got a lot of employees who are working just fine in a remote location. But we are also having discussions now with those same employers who are saying, now that they understand the cost of having those employees so widely dispersed, they are deciding which states they will operate in and which ones they will not. And so we are helping some employers with a communication to a person that is, listen, if you want to go to North Carolina, that's great, but we want you to know that that amounts to a voluntary termination or resignation because we don't have any intent of having our company operate in North Carolina. And the reason that they are coming to this decision is that when you send your staff to set up in Raleigh, you may, especially if you're selling stuff, a sales taxable stuff, or maybe it's not stuff, maybe it's a subscription streaming service, but in Raleigh, maybe it's taxable. What happens is by having an employee there, you have a physical presence. So all of a sudden you have to register in a lot of ways. It may be a reseller's permit, like I was just talking about. It could be, in addition to registering as a payer, a payroll employer in that state, you are also going to have to get a business license in that city. And when Lisa's team gets involved, they are setting up payer IDs. They're also learning whether there's work comp requirements there. The employee may find that they are positively or adversely impacted by moving to another state. For we Californians, of course, when they move to other states, they're thrilled to pieces. But the last thing that happens, which might not be so thrilling for an employer, is that, for example, in a partnership, a law firm or an accounting firm, each of the partners is now also exposed to taxation in that state as an employer, and the company has to file and disclose and report taxable transactions in each entity. So what happens is it's going to cost, and it could, at the low end, it might only be $5,000 for the owner, but for every owner that can really add up. It could add up to more like $10,000 per state. So if you're listening and you're thinking, ooh, I hate the idea of the app and I don't want to take people's temperatures, I'm just going to let people stay in Timbuktu, you probably want to preemptively do some research on the state and local tax effects of allowing your staff to work wherever they feel like it. You may not actually want to do that. The other thing we're being asked about is expense reimbursement policies. So if you were to just give all of your far-flung employees an allowance and say, okay, you get $1,000 and you get to buy whatever you want, that might be taxable income actually. Or you could come up with an expense reimbursement policy that allows them to purchase things for their home office, or maybe they want internet access or cell phone reimbursements. Those policies need to be written so that you're not exposing those employees to taxation, to payroll taxation, unless you want to do that. Yeah, that's your other option. You just give them some sort of a pay increase, and then maybe you don't worry about reimbursements for petty items. The other thing that we talk about a lot with people is insurance in that scenario, or even if you go back to your office right now, what is your exposure? What is going to happen? And I'm not sure I have the answer yet. When I talk to my insurance buddies, employer's liability could be interesting. Now, because insurers don't want to be exposed to liability, what they're doing is they are making COVID cases a work comp matter, a work comp claim. And this is why you want to have data. This is why you want to have an app for people who are coming back to work, or some sort of bulletproof record keeping. In California, they presuppose that the person got sick at work. If your policy is come back to work, this is where you do your job. If you have a policy that allows the employee to choose whether or not they want to come back, it may not be a work comp policy. So you may want to have your back to work app say something like, do you want to come into work today? So that they have to answer yes. I think that it's sort of, the assumption is you want to come into the office if you're using the app to come in. So we might need to make some changes to make sure that you are not exposed to risk and that you are clearly documenting your attempts to keep your staff and your workplace safe. Obviously, the minute people start getting sick and deciding who they're going to blame, people need to think about their employer's liability, their directors and officers' liability, and maybe talk to your insurance broker about a different strategy, including an umbrella policy. So if you're a COO type person listening to me, I would be really, really highly aware of the insurance policies that you have and the idea that they might need to change and morph to reflect a new world where you have a different kind of liability. And then remember, again, it could be short-term, not long-term. So you have to stay alert as we get to the end of this year and next year to make sure that you've made the right changes in the long run. And then we talk a lot about rent relief. We have been asked to help negotiate leases. There are some people who are just giving up the ghost and they are saying, forget it, I'm not staying in business. We have a restructuring team that's been called in to help wind down companies, and they do some really creative lease renegotiations because you just got to get out of it at that point. There are rent relief measures out there. We spend a lot of time explaining to our clients in each local jurisdiction what those rent relief measures are and whether they will help them in the short or long term. And in a lot of cases, rent relief might not be rent relief in the long run. It's really a deferral. It's not a forgiveness of rent, which is always something we have to explain. In terms of relief measures on local relief measures, that does also go back to your payroll. If Lisa Hagen goes to work in Arizona, Arizona might let me not register her in Arizona during the COVID crisis for maybe 6 months. They may let me do it for quite a while. So all that state and local stuff that I just scared you to death about, if in the short run, those states allow you to have relief, or those local jurisdictions allow you to have release, pause before you register in those jurisdictions and make sure that your employee really means to move there permanently and that you actually want that employee badly enough that you will register there. All right, so now the policy part, which is Lisa's section, we've broken up into several parts. If you are having an employee work from home situation, you need to have an agreement that might be a little more buttoned down than what we had before. It might have happened haphazardly, but if it's now happening across the board, you probably want to have some sort of agreement that has to do with attendance and communication and flexibility. Obviously, we talked about health testing. You have management training that is required because in all of these new things, your managers are the ones, I hope, who are helping you make this a practical application. So the HR piece of this requires a lot of training. Let's go. I think we have one last page here. All right. There are broad sections here. Workplace safety is an entire section. I'm sure most of you have already thought about a lot of these things. Who are you going to let in the building? Travel policies are really interesting. We talked about this last week on one of our webinars. You may need to look at the CDC site where they list countries and they rank them in order of danger zones. They have basically DEFCON levels. So right now, for example, Brazil, I think is a level 3 or 4 country, I can't remember, but you might want to write a policy that says to your staff, if you go there, I have to know, or you might take it further and say, if anyone comes to your household to visit you who has been in a country at a level 3 or above, you have to report it to us and we will ask you to stay away from the office, or we may ask you to quarantine. That can be tricky if these people do not get paid for that absence. And sometimes a leave might cover it. Sometimes a leave of absence might actually cover it, but maybe not. And that leads us to the next section. There are family leaves and there are FMLA leaves. We've got new CARES Act related legislation, but we've got FFCRA leaves, which are for, Lisa help me, companies with less than 500, correct? And we have FMLA, correct, which is for companies with more than 50. So there's a little bit of overlap there in the leave management. So if you are listening to me today, July 7th, we have a lot of COVID cases all of a sudden at Armanino. When New York was having such a terrible time, we had less. We have less clients out in New York. But now in California, we're getting a call a day or 2 a day or 4 last Friday, clients who have COVID cases on site. Depending on the size of your business, people qualify for leaves, and they are administered differently. And some of them you actually get reimbursed for. So if you have less than 500 people you might be able to get reimbursed if you have to give someone a leave because they are affected by COVID in any way, if their absence is related to COVID. It's a little tricky. You have to ask them specific questions and verify that it's COVID-related leave, but those things are out there for people. The last piece here is very important. If you are listening to me and you did not have a PPP loan, and you did pay workers who were unable to be productive, this applies to you. The employee retention credit is to help employers who kept paying people even though they couldn't really be productive. This has been very, very helpful to people for the last 2 weeks of March. This started March 13th. So back then, I know it seems like ages ago, everyone, but it's really only a couple months. But back then, everybody went home. Friday the 13th was kind of a big day in March. The next 2 weeks, companies scrambled to figure out how they were going to work remotely. They set up technology or they didn't. During that time, some people continued to pay their staff. They felt that it was unkind and unfair, and so they just kept paying them. Meanwhile, that staff was not able to do their job. And this was not an absence like a sick absence or a vacation absence. It was almost like a new kind of leave that these companies created. In those instances, the wages paid to those employees are eligible for a credit of up to $5,000 a person that it affects. You first have to get eligible. So we are helping clients determine that they are eligible at an entity level first. So there are some gates we have to go through to make sure that entity itself is eligible for the credit. And then we go through and we identify the workers who were non-essential enough that they were able to not work for a while, and yet they continued to get wages. We identify those wages, and this all lands on the 941, which is a quarterly payroll tax return form. So most tax people, tax CPAs, don't really spend a lot of time on that. Lisa's team, which is an HR team that also has payroll specialists. So usually HR and payroll are separate, but at Armanino, we put them all into one room, literally together, wearing face masks, of course. But the payroll certified people working with the HR people identify the roles, the departments, the people who were paid but not productive, and then we get that credit on the 941. It's a refundable credit, and it amounts to a ton of money in the cases where it really applies. So I'll give you a couple examples. If you're a school and you kept all the bus drivers on payroll, but they obviously were not driving kids to and from school, the bus drivers, those salaries would be eligible for this credit. If you have a business that is essential, but there's a section of your business that's not essential, and you kept paying people, those wages are eligible for this credit. So think about that if you're listening. It could be a really impactful credit. And I think with that, I've gone through our entire to-do list. We are here to help you with any of those things. You can call any of us anytime. Lisa is the HR person. OJ is obviously the tech guy. We can hook you up with him if you would like to explore the app. And I think, is there one more slide, Sarah? Are we close to done? All right.
We're done. Well, I want to first say thank you so much to our presenters. That was a very detailed, insightful presentation. So I really appreciate you guys taking the time to educate our attendees. And I thank you all for joining our webinar today. I just want to remind everyone, we will be sending the deck and a link to our recording 8 hours after the end of this presentation. And we also ask you guys to give us your feedback. We have a survey that you will receive, and we would appreciate if you can take 2 minutes to fill that in to help us learn what we can improve. Again, and if you have any questions specific to this topic or want to reach out to one of our presenters, please use the email address experts@armaninollp.com to send in any questions. Again, thank you, everyone, and I hope you guys have a great rest of your day. Take care.